Welcome to the Mind, Body, Spirit Facebook Live series, Episode 4, The Power of Positive Thinking. Today's event is hosted by Debbie's Dream Foundation, Curing Stomach Cancer, featuring licensed psychologist Dr. Jennifer Akrish. Before we begin, we'd like to thank our generous sponsors for helping to make this program possible. Thank you to Bristol Myers Squibb and Merck. And now, Dr. Akrish will begin her presentation.
Hi, good afternoon. Thank you so much for having me here today. It's a pleasure to be here with you all. And today, today we will be talking about the power of positive psychology. So just to introduce myself, I know Brittany mentioned, I'm a licensed psychologist. I've been in practice for a little over 7 years, and I was originally practicing in Fort Lauderdale and now practice in Parkland, Florida. But I'm actually all virtual related to the COVID-19 pandemic. So I can see anyone as a patient who's located in the state of Florida. And psycho-oncology, how I began working with patients dealing with a cancer diagnosis, started when I was at the Miami VA Medical Center down in Miami. I had several patients there that were dealing with a cancer diagnosis, and I saw how it was impacting their psychology and their treatment, and I wanted to learn more. And I started advancing my training at that time. And then after that rotation, I did my pre-doctoral residency at Broward Health Medical Center, where I was called on a lot by the oncology unit, and I was often in the infusion center doing supportive therapy at the bedside or by people's side as they underwent infusions. And I became pretty close with the oncology team there, including the social workers and the oncologists and the nurses. And then after that, when I did my postdoc in private practice and did private practice afterwards, I just continued to get referrals from those resources. And during my pre-doctoral residency, I also became quite involved with Gilda's Club. And in addition to Debbie's Dream Foundation, they are another really wonderful nonprofit that supports people dealing with a cancer diagnosis. And I was referring my patients from Broward to Gilda's. And after some time, Gilda's reached out to me and asked me to run support groups there. So I did that for several years at Gilda's Club, and I ran support groups for people that were managing a cancer diagnosis themselves. I ran support groups for caregivers or loved ones, as well as a pediatric support group for kids facing cancer diagnosis themselves or who had a loved one facing cancer. And Gilda's Club is who introduced me to Debbie's Dream. So that's sort of why I'm here today, and I'm very grateful for that. So we're going to be talking about positive psychology and how it can help to improve your mood and increase the quality of your life. And before we delve into those specifics, I'd like to go over the definition with you. So positive psychology can be defined as the science of positive aspects of human life, such as happiness, well-being, and flourishing. It can be summarized in the words of its founder, Martin Seligman, as the scientific study of optimal human functioning that aims to discover and promote the factors that allow individuals and communities to thrive. And the book I will be reviewing today, because I read a few different books when I was doing my graduate training on positive psychology, but this one is my favorite. It's my favorite personally, and it's certainly my favorite to refer to my clients because it is written more as a self-help book rather than as a book for clinicians. I like it. It's very digestible. It's very empowering. It talks about how to implement positive psychology strategies into your everyday life. And the book is full of effective and research methods of how to increase your happiness. So one of the first things that the author talks about in the book is what exactly determines your happiness. And she discusses early on that many people attribute their happiness to their circumstances or to their achievements. But the author really challenges this notion, as you can see by the pie chart. She says that only makes up about 10% of what makes up our happiness. She shared that the average person is looking for happiness in the wrong places. Things like getting married, purchasing a larger home, having a child, winning money, or having more free time. She acknowledges will increase your happiness for some time, but it tends to be short-lived. So what does determine happiness? She talks about one of the things is intentional activities, which is what we're really going to go into today. These are purposeful behaviors and activities that are clinically proven to increase your happiness and your well-being. And then life circumstances, as you can see, she said makes up about 10%. We already discussed this. So these are things like illness, having a baby, buying a home, losing your job, getting a promotion. They do impact your happiness, but not as greatly as one might think. And then genetic set point. I found this really fascinating because I've observed this a lot in my practice. The author compares a happiness set point to a weight set point. So the comparison there, as you may have witnessed in your own life, many people sort of have a weight set point. Are you someone who's naturally, thin, naturally kind of more average, or naturally maybe a little bit on the heavier side? She explains that happiness works like that as well, right? Someone might their baseline might be more depressed, or maybe you're someone who's just more content or, a little apathetic at times, or are you a naturally happy person? So naturally happy, content, or depressed, again, are the typical types she sees. And then research was done with identical and fraternal twin studies that suggest that we genetically inherit our happiness set point from our parents. It is this baseline that we are bound to return to after major setbacks and triumphs. The author says that increasing your happiness and maintaining it takes significant effort and energy, but it is possible to do. The author compares increasing your happiness to exercising, right? In order to continue to reap the benefits of exercise, we have to continue to do it. Brittany and I talked about this when we did our run through the presentation. We can't just exercise for a month or 2 weeks and then, continue to be physically fit forever. It's something you have to constantly do. And she compares the happiness increasing behaviors to that. There's something that you kind of have to do throughout your life in order to maintain that increased level of happiness. So how happy are you and why? Another thing I really love about this book is it's full of self-reports. So self-report basically is just a research measure that you complete on your own. You fill out questions, and then she will let you know, based on the results of the questionnaire you fill out, it will help you to identify your baseline happiness. In this chapter, she also debunks happiness myths. And I was happy to read this because I hear these myths come up a lot in my office. One of the myths are incorrect notions is that happiness must be found, right? The author challenges that. She says rather than trying to chase happiness or look for it, it's really important to try to cultivate it from within or engage in behaviors that will improve it or increase it. Again, number 2 is in line with that. Happiness lies in changing our circumstances. The author really challenges that. And you have it or you don't. Again, this is something I've heard before in my office. Maybe someone who errs naturally a little bit more on the depressed side might say, listen, that's just never going to happen for me. Again, the author challenges that and says it's not true. There is ways to increase your happiness. And then in this same chapter, she also discusses the definition of hedonic adaptation, which is just people's general tendency to return to a set level of happiness despite life's ups and downs. So how to find happiness activities that fit your interests, your values, and your needs. 40% of our happiness is rooted in intentional activity, and precisely which activities or strategies can help you reach your desired level of well-being. It's important to find happiness increasing activities that work well for you. Again, the activities that work well for me and might improve my happiness might not work for the next person. So finding ones through the book, and there are many different ones that she discusses, finding ones that fit you and your personality and your lifestyle is really important. It's important because it will make the activities more effective and more maintainable. And in the book, there is a person activity fit diagnostic. So again, this is another self-report measure you can take that will sort of guide you to activities that might be a good fit for you. So these are some of the all of the different happiness increasing activities that she talks about in the book. Originally, I wanted to go over each and every one of them. And as I was designing the presentation, I soon came to realize that, oh my gosh, I could probably teach a whole class on this book and all these interventions. So what I've done is I've sort of handpicked the top 4 that I go over with my clients. This does not mean that they are the best. These are just the ones that I've used the most in my sessions. If you're interested in these, I really encourage you, get the book, look into it, and really try to find the ones that work best for you. So the first happiness increasing activity we are going to discuss is practicing gratitude and positive thinking. Gratitude is just a clinical term really to express, being grateful. I loved this definition by Robert Emmons, who described it as a felt sense of wonder, thankfulness, and appreciation for life. So here are some specific examples of how one could implement gratitude, because it's one thing to say, well, if you're more grateful, you'll be happier. It's like, okay, great. Well, how do I apply this to my everyday? One way you can do this is through a gratitude journal. You could ponder about 3 to 5 things that you're grateful for, from very simple things to really big, fantastic things, and write them down. Research suggests that doing this once a week can be very helpful. And some people benefit more often from doing this 3+ days a week. And I even have clients that do this every day. Sometimes they'll do it in a little handwritten notebook. Sometimes they'll do it on their phone. But it can be just jotting down 3 things a day that you're grateful for. And again, it can be something so simple like, your flowers bloomed in your garden today, or the mailman smiled at you when he came by, or something really fantastic. Maybe you got good news related to your diagnosis. Maybe, you're buying a new house, or, something big is happening, but it doesn't have to be big. It could be the simple things. Another way to practice gratitude is express it to another person. And you can do this through writing a letter to someone that you really care for and you're very appreciative of, making a phone call to somebody and sharing, this appreciation for them, or telling them in person. This is something I go over a lot in session with my clients. We so often can get into a bad habit of taking loved ones for granted and not expressing gratitude and appreciation for them. And it's such an important part of a healthy relationship. And this book also supports that it's not only great for the relationship, it's good for the individual who's saying it and expressing the gratitude. And it's obviously also beneficial for the person on the receiving end of that gratitude. So the next strategy we're going to discuss is practicing optimism. And again, I just love the author's definition of optimism. We're going to go into that. And I think especially with the trying times that we've had in the last 1.5 years, this really spoke to me, how important this can be to have an aspect of this in one's life. Being able to, she describes it as looking at the bright side, finding the silver lining in the cloud, noticing what's right, giving yourself the benefit of the doubt, feeling good about your future or the future of the world, simply trusting that you can get through the day. These are all optimistic strategies. And then again, some more specific strategies are the best possible selves diary exercise. This is actually an exercise I do a lot with my clients. Sometimes rather than a diary entry, I'll just challenge them to describe this to me. But what she describes is taking about 20 minutes to write about your most important and deeply held goals and visualizing that those goals will be achieved. Studies suggest that participants who engaged in this exercise for 20 minutes a day over several days relative to those who wrote about other topics were more likely to show immediate increases in positive moods. Another strategy for increasing optimism or practicing optimism is identifying barrier thoughts. So this would be identifying automatic pessimistic thoughts and replacing them with a more favorable or charitable point of view. Again, I do this a lot in my office through cognitive behavioral therapy. An example I gave Brittany when we were doing our run through is, let's say, you go into work, you're working, and you make a big mistake at work, right? Your automatic thought might be, if you're in a negative space, I'm such an idiot. I always mess everything up. What is wrong with me, right? Might be having these negative thoughts. Through cognitive behavioral work, we learn to challenge that and replace it with something more rational, right? To say that you're an idiot or you don't know anything is probably grossly unfair and a little bit irrational. That's more of your emotions, taking the wheel rather than your intellect taking the wheel. So challenging that with something more rational, or as she's saying, maybe more optimistic, of saying, okay, let's acknowledge, right? This was a misstep. Well, I'm going to learn from it. I'm going to grow from it. I can be better from it. If you are someone that is often challenged with negative or self-deprecating thoughts, when you have little missteps, or even when you don't, if you just really struggle with being very negative and self-critical, cognitive behavioral therapy can be very helpful for you. So I really encourage you to get in touch with a cognitive behavioral therapist if that's something that's challenging your mood. So avoiding overthinking and social comparison, these are things that really can contribute sometimes to depression and anxious symptoms. Social comparison is rarely healthy. I often see it be pretty detrimental for my patients. If you're having the urge to socially compare to someone, I often encourage my patients, try to boil it down and see what it is that you're desiring that other person has. That's usually what it's about. And then rather than focusing on the comparison or that you're less than them or more than them or however you're looking at it, think of how you could incorporate that thing that they have that you want into your life, or maybe grow it into a bigger space that you're wanting it to be in. So the author has some specific strategies for battling these things. One of them being to distract yourself. Excuse me. So she says that you should be engrossed in an activity, something that's so engrossing that you don't have the opportunity to ruminate or to continue to think about these things. Another technique she describes is the stop technique. So if you're having negative thoughts, or again, you're being down on yourself, you could think sort of in a loud voice, or even say out loud if you're alone, stop. Some of my clients will also picture a red stop sign to really get the point across, to stop thinking about it and then put their thoughts into something else. Assigning 30 minutes a day to ruminate. This is a strategy that I know a lot of therapists use. So they will assign you 30 minutes a day. Let's say from 4 to 4:30, you're allowed to worry all your worries. And that way, if you're really feeling pushed and pulled by these ruminations or these worries, you can tell yourself, I have time to worry about this later. My time to worry is 4 to 4:30, and right now I'm going to put my attention and energy into other things. That way it's not taking control of your whole day. Talking to a sympathetic or trusted friend, this can be incredibly helpful. Even just telling a friend, quite honestly, I'm just looking for someone to listen. Having a friend to sort of be a sounding board can really make things that feel insurmountable or unmanageable feel more manageable, once you're talking about it out loud with a friend. And then writing. So this could be journaling about your worries. That can be a really healthy way to unburden yourself. Sometimes I'll also tell patients to keep a notebook next to their bed if they tend to worry a lot in the evening. Some of my clients will tell me, I'm so busy all day, I don't really have time to worry. And then my head hits the pillow at night and all of a sudden I'm flooded with all these things and I'm worried about things that I might forget the next day. So what I'll tell them to do is just keep a small notebook next to their bed, and they can jot down anything they're concerned about and then close it and put it away, knowing they can consult that notebook the next day and they can rest peacefully that night. Because another thing, which we're not specifically going into today, but it's important, healthy and adequate sleep is so important for healthy mood and healthy functioning. So when our worry is impairing our ability to sleep, it really can challenge our mood in a great way and make it much worse. Acting to solve problems. So if you're faced with a problem, you're feeling overwhelmed with it, resisting the urge to avoid, taking time to write down a list of possible solutions to that problem. And then if you're feeling stuck, like you can't come up with good solutions, the author suggests thinking of someone you highly respect and thinking, what solutions would they choose? Maybe you have an uncle or a boss or a grandma or someone that you really love and respect. You're being faced with this big problem. You can think to yourself, okay, how would Aunt Edna handle this, right? Or how would my best friend or my big sister handle this situation? That can kind of help you get going in the right direction. And then taking in the big picture. Again, when you're challenged with something or you're feeling overwhelmed or like this is insurmountable, you can't take it on, ask yourself, will this matter a year from now? So many times the answer will be no. And if the answer is yes, it probably does warrant the amount of attention and energy. But if the answer is no, keeping that in perspective, addressing it, and moving forward. Nurturing social relationships. Again, another quote that I thought was really beautiful and spot on that she mentioned in the book. This article is called The Need to Belong. And the authors are Baumeister, I hope I'm pronouncing that right, and Leary. And the quote she put in her book is that humans are powerfully motivated by a pervasive drive to seek out and maintain strong, stable, and positive interpersonal relationships. I have known this to be so true in my clinical work. I've seen it a lot in my practice, and it's really been challenged in the last year and a half with what's been going on with COVID and people being more isolated. Another interesting thing she mentioned in the book is that an analysis of 3 communities of very long-living people in the world, so the Sardinians in Italy, Okinawans in Japan, and the Seventh-day Adventists in Loma Linda, California. They had 5 things in common, and at the top of the list for all 3 of them were putting family first and keeping socially engaged. So these are all cultures that are known for their longevity, right? Which suggests that having these close social relationships is in line with a long, healthy life. If you're interested in learning any more about that, there is this fantastic book called The Blue Zones that I highly recommend. And it just talks about habits of people from these cultures that are very long living and have very high quality of life for a long time. And then actually, before I move on, I did want to ask, again, I mentioned as it relates to the pandemic, I know some of my clients that I work with are feeling a lot more isolated. I definitely want to, check in with everyone and ask everyone, how are you staying connected? What are you doing to connect with other people? It's so important right now. It's easy to become isolated, which can make, if you're dealing with any depressive symptoms or anxious symptoms or stressors, much worse. So I am challenging people, even, everyone should be cautious right now, but even if you have to be extra cautious, get creative with your connectivity. Even if you're teleconferencing with people, writing letters, texts, however you can stay connected. Maybe you feel comfortable putting on a mask and going and taking a walk with a friend. But social connection is so important for human beings. So finding ways to stay connected during this time is going to be very important for your emotional functioning. And then types of social support, there's a few different types. So the one is tangible. So this would be like having someone to drive you to the doctor's office if you can't drive, or take you a meal if you're in need of a meal, or medicine when you're sick. Emotional, someone who can listen and reassure you, help us generate solutions. Strategies for investing in relationships. Number 1, making time for relationships. Expressing admiration, affection, and appreciation for your loved ones. Capitalizing on their good fortunes, taking delight in your friend and family members and partners' windfalls and successes. These are all great things for your social relationships. And learning how to healthfully manage conflict. If you are close enough to someone, conflict will come up, and having healthy ways to work through that is so important. If you are someone that struggles with conflict, or maybe says, very negative things or things will hurt the other person when you're angry, and that's something you want to work on, there are lots of therapists out there that are very good at helping with anger management or conflict resolution skills. So if that's something that you're ever looking to do, I really encourage you to do that because it can really help your relationship. So the conclusion of the book is that everyone has a different baseline for happiness, right? You might err on the depressed side or the content side or even the naturally happy side. But the author really strongly believes through her research that anyone can improve their happiness by regularly engaging in these happiness increasing activities. And again, this book, I really like it. It's very digestible and usable. And all the strategies that she recommends in the book are supported by research. So now we have time for some questions.
Perfect. So, Dr. Akrish, a few questions came in.
Sure.
Question number one is, are there any other books that you would recommend to patients regarding the power of positive thinking or positive psychology?
So there are these, it's like a whole genre. So if you're into this, there are tons and tons of books out there that you can find. Honestly, the ones that I've personally read, a lot of them have been more clinician focused. So the How of Happiness has been the favorite one that I have personally read. This is the one that I recommend the most to my patients. Some of my colleagues have highly recommended to me Flourishing by Martin Seligman. He is considered the founder of positive psychology. So I imagine it's a fantastic book. I haven't gotten to personally read it myself, but I've heard of very good things. And I've heard it's very friendly to people outside the field of psychology.
Thank you. Next question is it a good idea to get my loved ones involved in my process of thinking more positively? And if so, what are some ways that I could have them join me on this part of my journey?
So I usually encourage my patients in my office, sort of start focusing on yourself when it comes to this journey first. What I found with many people I work with over time is that your loved ones are going to notice changes in you, right? They're going to notice that your mood is a little bit more improved. They're going to notice that maybe you're happier or finding joy in things that maybe you weren't previously. And a lot of times people will want to get on board with that. And they'll say, hey, Brittany, what are you up to? What's helping your mood improve? Or you seem so happy. What's going on? That can be a really great time to share resources. Certainly, if you have a loved one or a friend you think could benefit from this, or maybe you're concerned about their well-being, you could always, tell them about what you learned today and share them resources. But I'm always hesitant in anyone sort of pushing it on a family member if they're not ready. Just like with therapy, sort of self-improvement work, it needs to be internally motivated. So that person really has to see the purpose in it and be motivated to do it for it to be successful.
Awesome. The next question, you mentioned the benefits of being positive. Can you share the downside of being stressed and depressed or in negative emotional states? How can this impact me as a cancer patient?
One thing I want to start out before we kind of delve into this one and say, you are going to have stress, right? Everyone experiences stress, especially anyone dealing with a cancer diagnosis. Experiencing stress is normal. So sometimes I'll have people come into my office and they'll say, well, I want to eliminate my stress. And I tell them, unfortunately, that is impossible, right? We can't eliminate your stress, but we can improve your ability to cope with your stress and navigate your stress and make it so it's not impacting your life in such a great way. So some side effects that can happen if someone's experiencing clinical level anxiety or chronic stress that's not well controlled or depressive symptoms. Some psychological side effects are we're going to see increased incidence, right, of anxiety, depression, sleep issues, things like that. And then on the physical end of things, again, sleep challenges, sometimes gastrointestinal issues will come up. Our gut is very connected to our mood and how we're feeling psychologically. People might experience muscle tension, fatigue, immune challenges, things like that can all come up through chronic and pervasive stress.
Wow, thank you so much for sharing.
Sure.
Um, Another question, do you have any recommendations for those who may find any of the activities you mentioned to be too difficult or hard to implement? Do you think that like therapy is a better option?
Therapy, I mean, I'm biased, right, as a psychologist. Therapy can be a really healthy option. This book certainly does not replace therapy at all. I think if you're struggling with any anxiety or depression, I really do encourage you to do therapy and sort of use this book as a supplemental measure. If your symptoms are more mild, this might do the trick. Um, Also, if you're finding some of the techniques hard to do a little trial and error. Like I think there's 10 different strategies. So let's say you try the first two and they're not working out. Go through some of the other strategies. Sometimes you really don't know till you try it. So try those different things. But again, if you feel like you're experiencing clinical level anxious symptoms, depressive symptoms, or another psychological disorder, this does not replace therapy. Get connected with a therapist and do that work with them. And some of you might be asking, well, how do I know if the problem I'm dealing with or the mood symptoms I'm dealing with are, excuse me, clinically significant? We usually indicate that by looking at how it's impacting one's social or occupational functioning. So if it's impacting your functioning in your personal life or in your professional life, that's usually an indicator that it's clinically significant.
Thank you. And last question. I've seen lots of work being done around mindfulness or meditation. Is this something that you recommend also? If so, why?
Yes. I'm a huge fan of mindfulness and meditation. It can be great, doing great for anyone, especially if you're experiencing anxiety, but depression symptoms too. It can be very helpful. I usually implement mindfulness in my practice through a therapeutic approach called dialectical behavioral therapy. One of the main tenets in that therapy is mindfulness. Mindfulness, if there's anyone out there that doesn't know what it is, mindfulness is really sort of the practice of being present, which sounds very simple, but honestly, as adults, we are very rarely present. Most adults are very future focused, or they might be ruminating on what's happened in the past and they're not so present in the moment. A great example of being present is, any of you that are around young children, they're often very in the moment. As adults, we don't do that so much. And giving yourself that break of not being worried or not thinking back on things that didn't go so well and being really present and in the moment can be so beneficial for your mood and really alleviate some of these symptoms. And meditation, has been so researched and improved and shown to improve people's well-being. And it can start out really small. There are guided meditations that you can find online that might be as little as, 5 minutes a day. I'll have clients when they get started, maybe they'll do 2 to 5 minutes of just diaphragmatic deep breathing on a yoga mat to start their day and practice clearing their mind. But yes, I definitely highly recommend meditation and mindfulness as potential interventions. And I think they are mentioned in the book. So I think if you get the book, she has a whole chapter on that. And I think, Brittany, right, you had a speaker, I think, who spoke on one of them. I remember watching one of the videos.
Who spoke on which
Did
topic?
someone speak on mindfulness or meditation?
She spoke on outsmarting. Well, so we had one on outsmarting anxiety, and then we had also one on meditation. So yes, she did.
I think
Dr.
it was the meditation one I saw. I thought she was great.
Yes, she did a meditation practice for us.
Great. Awesome. Is there any other questions anyone has?
That actually concludes our questions. I just want to thank you so much, Dr. Akrish. We appreciate you sharing your expertise with our community, and we thank you for your time.
Awesome.
Today's
Sorry to
event
interrupt.
has been hosted by Debbie Stream Foundation, Curing Stomach Cancer. Thank you again to our generous sponsors, Bristol Myers Squibb and Merck, for helping to make this program possible. And thank you to everyone for joining us today. Please be sure to check out the replay of this video and more on our website at www.debbiestream.org. And also, if you'd like to contact Dr. Akrish, her information can be found on the screen. Thank you so much and enjoy your day, everyone.
Thank you everyone for joining.